The Wellness Hour. An in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, back pain and neck pain. With us, we have an expert on the topic, Dr. Pruitt. Dr. Pruitt, welcome to the program.
Thank you. It's good to be here.
Now, before we get into today's topic, which is very interesting, or at least to me, manipulation under anesthesia. I guess this allows you to get, I use the word aggressive, but allows you to really get in there for patients that are really sore or in pain. Is that right?
Yeah,
they're
that's right.
out. They're under anesthesia during the treatment.
They are, yes.
Okay. Now, before we get into that, for people that don't know about Arizona Back Institute, tell me a little bit about your center, what kind of patients you see.
The Arizona Back Institute really is the premier non-surgical back and neck pain clinic. We offer patients really who have suffered from back and neck pain for many months to many years an alternative to drugs and surgery. We see people that essentially have exhausted conservative care. Many have had surgery already and have failed. And so we really give them another opportunity to get better without, again, resorting to drugs or invasive surgery.
You know, I watched, and I like people to know that this is not an endorsement for you. This is a real interview. Our shows, air throughout the U.S. and Canada. But I think what you're doing is really good. That's why we invited you on the show. But I went on YouTube, listened to the patients talk about, sound like an exaggeration, some of these miracle stories of people that were in pain. They thought they tried everything. They couldn't do anything. It all turned around. Is that typical? Is that common? I mean, are there a lot of these stories?
There's many, many stories just like that. And that's really what we look for. When a patient comes to my office, they've tried everything in their mind. And when we're able to afford them a solution to their problem, it's life-changing. And people, they lighten up. They get extremely excited about it. And you've given them a new lease on life. And their emotions come out. And that's really what you're seeing on those videos that we shot.
Okay, good. Now you do traditional chiropractic. You do spinal decompression. What am I leaving out here?
Well, our program is more focused on the chronic back and neck pain patient. We don't have a traditional chiropractic practice like most doctors do. I cater to patients really who have exhausted conservative care. So our typical patient is somebody who has been in pain for a long time. They've tried conservative care, injections, some even surgery, and we basically try to afford them, again, a solution to their problem. So our practice is much different than what you probably would expect.
So you work with medical doctors, send you patients?
All the time. All the time. We offer, again, an opportunity for them to, especially when they've exhausted their ability to take care of a patient, whether it's with injections or medications, or they're concerned about addiction with narcotics, we give them an opportunity to send a patient to us and do things that are not based on those types of things.
Okay, now, I always make the assumption that, people know now, it's pretty much mainstream, that chiropractic works.
Works very well.
I mean, I hear about it all the time. The medical doctors that I talk to say, yeah, it does. It doesn't work every time. I guess not everybody's a candidate. Or are they? I mean, what are your thoughts on that?
Well, all the new studies in back pain right now show that manipulation, both in the acute and chronic low back pain patient, really is the first line of defense. And I think as the studies come out and that becomes more and more, understood in the medical circles, you'll see a lot more chiropractors taking care of back pain patients.
Do you still get patients that, they say, doctor, this is Dr. Pruitt, this is my first time ever going to a chiropractor?
All the time.
Really?
All the time.
Oh, it's common.
Yes, all the time.
What do they say?
Well, they just don't know a lot about it. And of course, if they have a medical doctor or somebody who's not really used to sending patients to a chiropractor, they come because of the information that we're able to put out there for people to educate them on what we do. And so, when they come to me, though, they don't really look at me as a chiropractor per se. They look at me more as a guy who really knows.
People just want to get out of pain, right?
Exactly.
So they don't care who they go to if somebody gets the results.
No, and I think sometimes they forget who they're talking to because, again, we try to be very thorough in our evaluation and our explanation of the problem to the patient. So I want them to really know that we do know what we're talking about. And whether I'm a chiropractor, a physical therapist, or an MD, this knowledge is available, and I just want them to feel comfortable with it.
Tell me about your continuing education.
Well,
I know you're big on education.
Big on education. I mean, the back pain world changes all the time. And I'm also a board-certified chiropractic neurologist, so part of that is continuing education on a yearly basis. You have to maintain a certain standard of care and of...
So chiropractic neurologist.
Yes.
And help me understand that training.
It's a postdoctoral program that focuses on functional neurology. If you look at the neurology models nowadays and the way we're learning more and more about the brain and the nervous system, the chiropractic model really fits well into that because it's a rehabilitative kind of approach. And so for me, when I got into the neurology aspect, I began looking more and more at back pain because, again, back pain is a neurological condition per se. And the more you know about the nervous system, the more you know about function, the better you're going to be able to handle a patient.
Are you better today? By the way, when you talk to a patient, I guess you do your evaluation, whatever. Are you at a point in your career where you think, I think they're going to get great results? I mean, do you feel that?
Absolutely. And it's funny
Really?
because, well, most people that come to my office, you have to understand, they've been through the ringer. They've done lots of things and have tried and failed lots of things. They're very skeptical. And sometimes I think that my confidence in my ability to take care of their problem really comes through, and they begin to trust again. But that's a big problem because you have to overcome the fact that they've tried and failed many, many different kinds of treatments. But yeah, I can look at a patient, especially have to evaluate them, and I've seen thousands and thousands of patients now, so I do know who really has the highest probability of getting better.
Okay, good. One of the things I like about you, and I'll quote Andrew Weil. I think he's from your neck of the woods over there.
I just saw him the other day, actually.
Is that right? Well,
Yeah.
one of the things he says, and a lot of people know Andrew Weil, and he's on Larry King all the time, is what do patients want? They want a doctor that can explain treatment in a way they can understand. That's why I like having you on the show, because we all learned something that day about pain and things like that. So let's start with this manipulation under anesthesia. I have that right.
You do.
Is that right? Okay, and that's doing treatment, chiropractic treatment, while they're out.
Yes.
Help me understand. Tell me a little bit about it.
Well, manipulation under anesthesia really has been practiced since the 30s and 40s. Orthopedic surgeons, osteopaths really started the trend, and chiropractors are doing it more and more. We do more manipulation than anybody else, so it just makes sense. It's a procedure where we take a patient into a surgical center environment and apply anesthesia to allow us to really take care of things that we can't take care of while they're awake because they're in too much pain. They're in too much pain.
So there's a lot of people that are in so much pain, they avoid going to a chiropractor, physical therapist, or whatever.
Or they've tried it and they weren't able to get the relief, or they get temporary relief, or they get relief that just doesn't last to the point where they can go on with their lives again.
So who does the anesthesia?
Either a board-certified anesthesiologist or a nurse anesthetist. It just depends on where we do it at.
Let's start with this story. I love the story you just told me in the other room, in our green room. You said that somebody was going to you and their medical doctor for their neck pain.
Correct.
And they were scheduled to do this manipulation under anesthesia with you, and they were warned, don't do it.
Yes.
Tell that story.
Well, they had gone to their doctor because we needed to get another study done that he was going to perform. And once he found out what
it's a neck pain patient.
It's a neck pain patient.
Male or female?
It was a female patient, and her and her husband had come to see me originally. She had been dealing with neck pain for about 2 years. She had exhausted everything, had every single injection you can think of for her neck.
Like in a car accident or something? Or?
No. She actually was just, I forget the exact mechanism, but she literally one day, her neck started getting sore, and over time she began to lose range of motion. When she came to see me, she could barely turn her head left and right, and she was in so much pain. Her husband literally cried as he explained to me how this has been affecting her life. It was in a very emotional...
Younger person?
No, these are older patients. She's in her 60s.
Okay.
And she went to her medical doctor as part of our screening process.
She was already scheduled for this treatment with you?
Yes.
Okay.
And we send them to their primary care doctor to get some tests done, blood work, that kind of thing. And he looked her and her husband directly in the eye and told her not to do this, that we were going to hurt her in some way, and that he didn't think we should do it.
You told me break her neck.
He said break her neck.
He said they're going to break her neck.
Yeah.
Okay.
Yeah.
Did you break her neck?
No.
No, I know the end of the story. That's why I say that. But
yeah, no, we didn't break her neck. Long story short, she's doing very well.
So the husband, though, comes to you. They come back and say, hey, this is what our medical doctor told us. Don't do this manipulation under anesthesia.
Correct.
What was your response to that?
I was upset, obviously, because this doctor had no idea what we do or what we did or what the procedure was indicated for. But not only that, but he was potentially taking away a treatment to a patient whose life is miserable. This lady, her life has been so changed in the last 2 years. Her husband, all they do is go to doctor's appointments for her neck, looking for a solution.
So once you calmed them down and I guess lowered their fears to move forward, then what?
Well, when they came in to see me, luckily, like we talked before, I had very good rapport with these patients. They really trusted me because I explained her situation in detail.
All right.
So once we got past that, they realized that we weren't going to hurt her, and that I explained really the MUA procedure for anybody who is learning about
You call it MUA. That's
MUA, manipulation under anesthesia for short. It's a little acronym, but it's a very gentle procedure, more gentle really than what you would get in an office, because when the patient's under anesthesia, you just don't need that much force. And it really
so they're out completely relaxed.
They're out completely relaxed. And what you're really doing is you're restoring range of motion. There's
so
a lot
give me
of
an
stretching.
example. I mean, take me through of what you did with her. Okay, so she goes in, the anesthesiologist puts her out.
Correct.
Okay, and then what?
Well, the next step would be for us to then take her through the range of motion maneuvers. And we literally do things in flexion. We rotate her neck left and right.
Okay.
We laterally flex her neck left and right. And what you're doing, though, is you're breaking up scar tissue and adhesions that have formed in the muscles, in the joints of the spine, and you're restoring function and motion. And that
what you're
really,
saying is there's science behind everything you're saying. I mean, this isn't a theory that you're breaking up this stuff. Nobody would disagree. No expert would disagree.
Absolutely not. This stuff is mainstream textbook stuff.
Okay, good.
And by restoring her range of motion, what that does,
stretching the muscles in a way.
Yeah, exactly.
Muscles that haven't turned in a while.
Correct.
Sorry for interrupting.
That's okay.
I just feel like I'm getting this for the first time. Go ahead.
No problem. Basically, what we do is we restore her function, her range of motion, and by doing that, again, what you're doing is you're promoting a long-term healing environment, because as the tissues begin to go through normal range of motion, as the joints free up, it really does change things from a neurological perspective, and then rehabilitation can then take place in an appropriate fashion. So we did the procedure. We repeated it day 2 and day 3, and each day her range of motion was improving significantly. We give them instructions to do at home during, between the procedures to maintain range of motion.
So even after the first treatment, okay, she goes home. Does she feel any different that day?
Absolutely. She felt a lot better. In fact, her husband mentioned to me that he heard her walking around the house singing, which he hasn't heard in 2 years, literally with a tear in his eye. And this is how emotionally devastating this has been to them. But so we're done with the procedure after day 3. We get her into the office for rehabilitation, and now we're putting her through a rehabilitation process. And I just saw her last week in our office for one of her therapy appointments. She's smiling. She's in the Christmas spirit. She's walking around. She really is a new lady.
How does it change their lives, by the way?
Well, let me ask you this. Have you ever had back or neck pain?
Well, I've had a stiff neck before. Probably lasted a night or something. Or a
now,
day,
were you miserable for the day?
Yeah, stiff neck. I guess if you have a...
Yeah, imagine that 24/7 for 2 years straight.
Interesting.
And imagine the pain to the point where you can't sleep. It depresses you, and your life is revolving around doctor's appointments and medications just to take the edge off. And you have this life with your husband that you're no longer able to enjoy because you're limited now. That's what changes. We're able to give them their life back. Their function is restored. They can do things they want to do, and it brightens their entire life up. They can really be themselves again.
Good point. Now, with this woman, was she on medication prior to the procedure? Was she able to wean off the medication after the procedure?
Yeah, she was on a lot of medication prior to the procedure, and now, again, I just saw her last week. We were talking. She hasn't taken any medication now for several days. I mean, she's off it completely.
So with this woman, so I understand correctly, the manipulation under anesthesia allows you to do things that you just couldn't do while they were awake because they would be in too much pain.
Correct. I mean, essentially, when you look at the MUA procedure, it really is about scar tissue. And I don't want to get into a big...
I never even knew there was such a thing as scar tissue, by the way.
Every time you get
frozen
an injury,
or stiff muscles.
Absolutely. Anytime you have an injury and you have an inflamed area or joint, muscle, whatever it is, the body heals itself with scar tissue. And over time, that scar tissue accumulates. And people begin to lose range of motion and function as they age and as injuries begin to kind of build on themselves. And when you have a back or neck injury, a car accident, a slip and fall, a traumatic event, or even just overuse injuries like sitting at a computer for hours on end, scar tissue begins to form. And that scar tissue restores, or basically keeps function from occurring normally. And over time, you begin to lose that function. And you got to remember, we're dynamic beings. We're made to move. And when a joint is frozen or fixated or a muscle is shortened or tight, you start to lose that function. And it really does change the way you move during the day, the way you walk around, the way you play sports or your activities. And so the MUA procedure gives us an opportunity so that once somebody has had an injury...
MUA, for people just tuning in, we're talking about chiropractic treatment or manipulation treatment under anesthesia.
Correct.
Which allows the body also to relax more. And why does that help as well?
Well, again, when somebody's in pain, first of all, they're guarding themselves. They don't want anybody to touch them, essentially, or manipulations may hurt, or stretching may hurt, or even exercises may hurt. So the anesthesia really puts them into a very comfortable state. They can be very comfortable. Literally.
Well, the muscles tend to contract when you're in pain? Okay.
Well, they do. I mean, if you think about it, when somebody has an injury, the muscle contracts to protect the joint. It's a protective mechanism. So if you have this chronic pain syndrome that the muscles have shortened over time, you're going to be in pain. And anytime that joint is, you try to move the joint, it's going to activate more contraction. So it's very difficult to treat a patient that way.
What does this work best for? Neck pain or back pain?
Both.
Really?
Both. And
okay, then let's talk about, because when you say it's great for sciatica, help me understand why.
Well, again, sciatica is a term used to identify inflammation of the sciatic nerve or leg pain. If somebody has leg pain associated with dysfunction, whether it be from muscle entrapment, whether it be from a disc herniation, or even scar tissue after a prior back surgery, again, the MUA procedure allows us to restore range of motion, free up that nerve root, get things kind of loosened up to the
how,
point.
How, though? Let's talk about the how. Okay, so patient, you've diagnosed them, you've talked to them, you think they'd be an ideal candidate. They have a sciatica.
Correct.
What happens? What are you doing differently than what you would be able to do while they're awake?
Well, for example, there's a very common test that we utilize in orthopedic and neurological medicine, and that's a straight leg raise. You go to the doctor, we raise your leg to see how high it can go. It's an indication of sciatic nerve root irritation or tension.
So a typical patient, what? They can
barely go, and they've got severe pain shooting down their leg. One of the reasons is because they're in pain, but the muscles begin to contract because they're in pain. Obviously, there's a very big reaction occurring at the spinal cord level, but that I won't get into. But with the MUA procedure, what we can do is put them under and then very gradually stretch that leg. And that's why we do it in 3 days.
Really? What about a physical therapist? I mean, couldn't they? Isn't that what they do, is work that out?
Well, you have to remember, the patient is in my office in the first place because they failed physical therapy, or they failed chiropractic, or they failed injections or surgery. They've tried those things already. And that really is a great question, because you have to have tried and failed conservative care before an MUA really will be appropriate. And so the patients that see us have already tried that, and it doesn't work. They're in too much pain to do exercises. They're in too much pain to stretch. They're in too much pain to receive a manipulation that can benefit them.
So it allows you to be more aggressive then with your treatment when they're out.
Yeah,
I'm calling it aggressive.
Yeah,
I know you didn't like to call it aggressive, but it is.
Just because, again, it's a scary thing anyway, manipulation and anesthesia. It sounds scary. Aggressive, yes, from a physiological standpoint, because you can go deeper with the tissues.
You can treat them like a healthy person.
Correct.
Okay.
So, but it really is more appropriate, because again, when you restore function and motion by breaking up scar tissue and elongating muscles that have been chronically shortened and restoring motion to a joint, you're giving that person a functionality where they're normal again. And as they move around, they do their activities, they get back to exercise, they become healthier.
So give me a dramatic case of a person goes sciatica, they had sciatica, and you took them in on day one. I mean, how soon do they start feeling better?
I have a great story. There was a gentleman who flew in from New York, him and his wife. He was scheduled for back surgery about 3 weeks later, and he was looking at doing a spinal fusion. They wanted to do an anterior interbody fusion, and that includes metal and screws and the whole thing. And they really wanted to avoid surgery at all costs. So they flew in from New York. So on day one, we took him into the surgery center, and just like I was talking about, as we raised his leg, he could barely raise it off the table. It was so fixated with scar tissue, adhesions. But as we moved his leg over and over again and we did our procedure, the nerve just started freeing up. And literally, after he woke up in recovery, he was pain-free. He literally stopped taking Vicodin that day that he'd been taking.
Is that right?
Yeah, he'd been taking Vicodin for a year, lots of Vicodin. And he immediately stopped taking all Vicodin that day. And each day he got better and better.
So it takes you 3 days, though. You like to do 3 days manipulation under anesthesia, kind of flexing them, manipulating them, working their muscles out. Is that right? Am I getting this right?
That is right. And then what we do is we see them in the office daily for about 2 weeks. And again, what happens is that scar tissue forms very quickly. So you have to break it up. And for example, let me give you an example. Back in the days when they used to do knee surgeries, one of the problems they had was that people would have knee surgery done, and then they wouldn't do a lot of rehabilitation right away, so people lost range of motion. Now the standard of care is to do knee surgery, but then put them in a passive range of motion device. So as the knee is healing, it's going through full range of motion. Same thing with an MUA procedure. We take them through the procedure, and then for daily we stretch them, we manipulate them, we do all the things we did under anesthesia, but now without that restriction. And so as the body's healing, it heals normally again. And so at the end of 2 weeks, they have full restored function, and then we can put them into a strengthening program.
Okay, now this patient that you're talking about, okay, so the one, and you know, like I told you, these are real interviews, okay? We pay to air these shows on TV, but you say that they were off their Vicodin that day after the first treatment.
Yes.
So results not typical, probably all over this disclaimers, but I mean, the fact is, this happened to somebody.
Yeah, that was his story. I mean,
but is it common though? I mean, do you hear that where people? I mean, is that what they do when they go to you, or is that their goal to get off medication?
Most of the time, yeah, it is. So aside from just getting off the medication, one of the things he was able to do is when he went back to New York, he was able to go back to work. He'd been off work for months. So, and a big part of their life was outdoor activities and playing, doing things with the family. They hadn't been able to do that for a long time. In fact, his wife was telling me that he really was a very difficult guy to be around. He was very grumpy, very irritated because he was in so much pain.
Yeah, pain people, the inside scoop that I hear, I don't know if you hear this too, from medical doctors or doctors in general, that they don't like the pain patients.
No.
It's a very miserable group of people.
Well, back pain patients especially. It's one of the conditions that really will change your life in an instant, to the point where you have this big strong guy who's used to providing for his family. You take that away from him in an instant.
So this New York guy you're talking about, okay, so he's off the Vicodin immediately. What do they tell you? Do they tell you, doctor, I'm going back to work, I'm feeling better? What do they say?
I mean, he couldn't be more thankful. I mean, his life was completely turned around. In fact, I was at a conference several months later, and I ran into a chiropractor who actually treated him for the follow-up, because obviously he was out of state. We did our 2 weeks of post-MUA care, but then I sent him to New York back to his chiropractor for all the follow-up with instructions. And I ran into his chiropractor. I didn't know who he was, but he kind of sought me out in the convention and said, hey, listen, I treated this patient after you did the MUA on him, and I can't tell you what a difference it was. I saw him right before he got before he came out to see you. I saw him after the surgical appointment, and he was devastated.
Okay.
And you gave this guy his life back. Because I'm amazed.
You said, and we're just about out of time. I have to go to a break. But you said about that millions and millions of people nationwide are in pain. In Arizona, are you of the opinion that there are thousands and thousands of people that are in pain that don't have to be?
I think.
Do you believe that?
I believe it wholeheartedly. I think I shared some stats with you off camera where we have spent about $90 billion a year in this country for the treatment of back pain, and most of it is not effective. So in a 10-year study, they looked at the costs associated with back pain. It went up 65% to about $90 billion a year. But the biggest thing about that study was that we spent $7 billion a year before the study started on medication, and then it was $19 billion a year after the study was completed. That's how much we spend on drugs. And as you know, nobody wants to be on drugs.
Right.
There's too many side effects. It's just
but for them it works. I mean, they have to be.
They have to. They have no choice if they want to function to somewhat of a normal level. But again, being on drugs every day is not normal function, as you probably know.
Okay, right, right. And there are other things, so like pinched nerves or bulging discs. How does this play a role there?
Well, again, some of the most impactful studies that have been done on MUA actually...
We're talking about manipulation under anesthesia. So for people that are in pain, under anesthesia, they're out completely, allows the doctor to do manipulation, stretching, like a physical therapy as well, while they're out.
Correct.
And relaxed.
Yep.
And allows you to get more range of motion, et cetera. Okay, so
restore
continue.
Function. So you're asking about disc-related cases, and in fact, with MUA, some of the best studies that have been performed were on disc patients. In fact, one study that was done in the Journal of Bone and Joint Surgery showed that patients with an average pain duration of 10 years, there's an 84% success rate with people with confirmed sciatica.
And we're going to take a quick break. Okay. So we'll finish that thought in a moment. You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. We're discussing back pain and neck pain and the procedure manipulation under anesthesia. We'll be right back. You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, back pain and neck pain. And with us, we have an expert on the topic, Dr. Pruitt. He is the founder of Arizona Back Institute. Okay, manipulation under anesthesia. You say that it's being done everywhere, every day, and it's becoming more mainstream. What are the frequently asked questions that patients have? What do they want to know?
Well, they first want to know, how do you do the procedure? I mean, what does it entail? Is it painful? And to them, I always say no. I mean, essentially, I show them the maneuvers that we do under anesthesia, and they're very gentle, and they get it a little bit more. Again, manipulation, people get that in their head that it's something forceful or aggressive, and you keep using the word aggressive, which again, I try to show that it really isn't. It's very, very subtle.
But you're allowed to stretch, or it allows you to stretch people out a little bit more, push the limits a little bit of their natural flexibility or tolerance. Absolutely. While they're out.
Correct. Exactly.
Okay.
Exactly. So they want to know, how long it's been around, are there any side effects? And again, it's a very, very gentle procedure. Most patients, and we talked about this before, They may have some muscle soreness after the procedure, but that's about it usually. Most people feel better almost immediately, just like the case I just shared with you. You're really freeing them from pain. It's something that you're restoring function, and it's not painful. And so
when you say function, restoring function,
range of motion, their ability to play sports, to go to the mall if that's what they like to do, or play tennis or pick up the grandkids. In my area in Arizona, golf is a big thing.
60 is young today. That's about your typical age of your patient?
Yes.
That's very young.
Yeah, it is.
Really?
It's very young.
So, and a lot of people are in back pain. It's like you said to me on the break, the less people do, the less they do.
Yeah, I mean, obviously, I think anybody listening probably has had the experience where, they get an injury and maybe they stop initially maybe going somewhere. They don't go, say, to the park with their grandkids. And eventually that kind of snowballs into now they don't like to travel in a car for long distances, or they don't like to go to the mall with their wife.
All right.
Over time, things begin to kind of snowball and the function begins to gradually decrease over time. And it's one of those things where they just can't do what they used to do.
Must be a hard sell, though. I mean, it must be tough. Because I'm sure that you know that some people are just so tight, you're going, wow. In your mind, you're saying, this would be a perfect candidate. But a lot of people are probably resistant to this. That's my guess,
I mean, they are, but once we sit down and explain to them in depth really how the process works, it makes sense to them. It's one of those treatments where when I explain it to them, they get it. They get it because everybody knows that if you move, you feel good. And when you restore movement, you feel better. And so by restoring function, when you ask me about function, you restore movement to somebody who hasn't been able to move their arm, in years, or they can't, turn their head to go to back out of their garage. They get that if they could move better, they'd feel better. So it's not as a hard sell as you think, but it's interesting. It makes sense to most people.
Great stuff. I want to thank you for coming on the show. Final message: somebody, they're in pain, okay, and you say they always think they've tried everything. What do you say to them?
I say if you haven't tried MUA or manipulation under anesthesia, you haven't tried everything. Come see us, get evaluated, and let's see if you're a candidate.
The evaluation is free?
It is. We do a free consultation, free evaluation. Okay. And if somebody is a candidate, we'll tell you. If you're not, we'll tell you too. I mean, obviously, we've got a very high success rate, and it's high because we choose patients very carefully.
Okay, good. Thanks again. You've been watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again online or direct a friend to it, you can go to our website and just put in pain or pain management or Dr. Pruitt. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.